Welcome to Adapt NCLEX. This is the fourth video I'm making for the NCLEX questions on using common sense. For these questions, we're going to use common sense to answer respiratory questions because those are the ones you have to apply common sense. All the answers will look the same, but you have to apply some buzzwords, use the buzzwords, what is being asked, and say, what would I do in this situation? So 10 questions on respiratory. The first one is this: what is the next most important action? Right, there's a keyword there. Important action. So you got to pay attention. All the answer choice may be right. Right. So if this is you new, this is Adapt NCLEX. Thank you for joining us. A pediatric client is placed on a mechanical ventilator. Why? Because the kid probably is not breathing. So we breathing for the patient. That's the key. Mechanical ventilator means I'm breathing for you. You can do your breathing through an endotracheal tube. Several hours later, the nurse enters the room and finds the client in what? Respiratory distress. What is the next most important action? I'm breathing for you with the machine, and I came back, and you're not breathing, you're suffering. What would I do? Think about it. Use some buzzword, bring your content, and select the answer by being sharp, and at the same time, apply some common sense. Call the respiratory therapist to check the ventilator. Increase the oxygen flow rate on the ventilator. Begin manual ventilation with the bag valve max. Check the ventilator tubing for kink or disconnection. What do you think? If you have 1 second applying your content, what do you think you want to do? But you got to go back to the question. Think about it. I'm breathing for you with the machine, and you're having problem not breathing. If you call the respirator, what is he going to do? Whatever the respiratory therapist is going to do, you should be able to do that. If you increase oxygen on the ventilator, the key word is how do you know the machine is still working? If you're using the machine to give somebody oxygen and the patient is having a respiratory issue, you should check. Common sense should tell you that. Is your machine working? Same thing. If you're using an iron to iron your clothes, you put the iron in the plug, you expect it to come out. If you press your clothes, you ask yourself, as you feel some heat or stretching or lining of your clothes, if it doesn't do that, you got to check and make sure there's power going through your iron. Same thing. If I'm using it to give somebody oxygen using the ventilator, if they're not breathing or they have issue, I got to make sure the machine is working. How do you know? Disconnect the machine and give the individual oxygen and see if they're going to do well. Increasing the oxygen through the ventilator means you believe the ventilator is working, right? Checking the tube for kink is an obstruction. But do you know if it's still working? The best way is what? Disconnect it and provide oxygen to the patient. If they're doing well, I know that the machine is not working. This is the first thing you can do. Patient on a ventilator having respiratory issue. In this situation, disconnect them and bag marks them. And then later on, figure out what is wrong with the ventilator. So number 3 is your right answer. So that's the first thing we were going to do. So this is the first question. The next one: what is the next priority action? A client with the COPD is on 2 liters of oxygen via nasal cannula. He's drowsy, difficult to arouse, and has respiratory rate of what? 8. Something should tell you that this patient is not doing well. If I'm not doing well, you should fix me. Are you going to fix me? Use some common sense to find out the answer. 2 liters, and he's drowsy, bad problem. Difficulty to arouse, bad problem. Respiratory rate, bad problem of 8. I know this patient is in respiratory distress based on content, everything you've studied. Now apply it in a common sense way. Prioritization. I got to be sharp and pick something that is going to save the individual life. I'm going to give them more oxygen. You want to go to 4 liters, 5 liters, 60 liters? Ask yourself, do you call the rapid response to come and help you? Ask yourself. Stimulate the client to breathe deeper? Think about it. Place the client in the Trendelenburg position. What do you think? This is all common sense in some content. Which answer would you choose? If you know the answer, put it down. But which answer do you think is appropriate? Let me analyze the answers to you. I have a COPD suffering, having issue where COPD patient, I know based on my content, they should not have too much oxygen. 2 liters may be all they need. If you increase your oxygen, they'll stop breathing. Bad problem. If I put your head down, bad problem if you're having oxygen issue. The patient already not doing well. Why do you want to stimulate them to breathe? Call for an EP. Therefore, COPD patient should not get too much oxygen. Putting a head down is not good. Stimulate them to breathe. It's too late. He's drowsy. He has respiratory of 8. The patient is not giving any sedation. You know he's having CO2 narcosis. Therefore, call the respirator and rapid response to help you. You see all these questions, you can answer them. It seems very hard, but you can apply some content to be able to use it. What is the first nursing intervention? A teen with a history of asthma runs into the emergency room, wheezing and unable to speak. I said this question to let you know sometimes the NCLEX is not going to trick you. They will give you raw information. They expect you to apply some test-taking strategy, right? And some common sense. The patient has asthma. He came in wheezing and is unable to speak in full sentences. This alone telling you is in respiratory distress, acute asthma exacerbation. What are you going to do if you are the nurse? Are you going to ask the patient what happened to you before you are in this situation? Are you going to listen to the patient's lung or give them oxygen or give them albuterol, right? Albuterol, which is a rescue inhaler. They are in trouble already. Why don't you fix them before you ask questions? Asking about the trigger, is he going to solve the wheezing or is unable to speak in full sentences? Of course, you know with your content that asthma patient, you got to do the what? Open the tube before you can give them oxygen. So open the tube. How do you open the tube? Bronchodilator. Give them a bronchodilator to help them. So open the tube so that they can breathe. Listening to their lung, they're telling you, I'm wheezing. That is your physical exams. You don't need any more physical exams for this patient. Speaking in full sentences is unable to do that and wheezing. You don't need any more physical exams. A lot of people will choose number 2. Don't choose it. I've given you enough of physical exams to be able to answer the question. Give them rescue inhaler. The client admitted with pneumonia. This is the same idea. Now has what? Confusion, physical exams. Respiratory of 32, physical exam. That's your assessment. Oxygen saturation of 88 on 4 liters. I'm not doing well. What would you do? You want to wait another 15 minutes? Do you want to increase the oxygen level to 6 liters? Do you let the doctor know? Or elevate the client head and encourage deep breathing? What do you think? If you have to choose one, what would you choose? I can tell you, patient is not doing well. Increasing oxygen level is not going to help him. 4 liters is enough. Waiting for 15 minutes, you're going to cause problem. Calling the doctor, you can do something before. Therefore, let the patient elevate their head while you're calling the doctor. This is the easiest thing. You can do this without not getting any orders from anybody. elevate the patient head. That will improve their function. This is number 4. Number 5, a client diagnosed with active TB is placed in the share room. Which action require immediate intervention? This is a straightforward, no trappy, straight, simple question, but it can be tricky, right? Patient has active TB is placed in what? In the share room. A share room means you have sharing a room with another patient. Which of these do you worry about? A client wear a surgical mask during transport. Is that what is required when you have active TB? Should you wear a surgical mask during transport? The roommate has no known history of TB. The roommate has no TB. The nurse wear N95 respirator. And the visitor wear respirator masks. Think about it. Think about it. All these questions asking you, look, if I put a patient in the room with another patient who has no TB, hey, wrong move. I don't know what 1 is saying. I don't know what 3 is saying. I have no clue what 4 is saying. But she should tell you that somebody with the active TB should never share a room with anybody. Whatever, if they need to wear surgical masks, I don't care. If the nurse need to wear N95, I don't care. If the visitor need to wear respiratory, I don't care. Common sense should tell you active TB should not share a room with anybody. Therefore, 2, roommate has no history of TB. That's red flag. And this is teaching a client with emphysema about energy conversation. I always say, go with the buzzword, and then apply common sense. Which statement shows they need more teaching? Well, the main content here is what? Energy conservation. Therefore, every answer choice, I have to pick something that say energy conservation. That's all. I have to pick an answer that represent energy conservation. Don't deviate. I will use a shower chair when I bath. Oh, energy conservation. I will rest after meal to avoid getting short of breath. Energy conservation by resting. I will lay flat after walking to catch my breath. Well, it's energy conservation, but do you want to lay flat? I don't know. I will do activity slowly and take breaks. Breaks and slow. Energy conservation. You can see which one is the answer. Just applying it. One of them as a partial answer, some of them as full answers. Of course, if you're walking and you're tired, you catch your breath. Do you want to lay down? If you have emphysema patient, if they have respiratory problem, how to conserve their energy, improve their oxygenation, is to be semi-upright or tripod position. That's the key. Therefore, 3 is saying something bad. 7, a toddler with RSV is irritable, nasal flaring, and refusing fluid. I'm giving you everything the NCLEX will give you. This patient is in trouble. He's telling you he's not doing well. You have to apply a little bit content, right? Little bit of content. You have to know your stuff. That one, you can't go away from it. Content is content. So you got to know it. When you're picking an answer choice, buzzwords, test-taking strategy, and sometimes common sense. There's the content here. You should know what RSV is. It's common in young kids, less than 6 months. What kind of symptoms they have? Nasal congestion and rhinorrhea, a lot of discharge from their nose. When they have irritability, nasal flaring, and refusing fluid tells you they're not doing well. So treat the management. Don't get trapped, don't get disturbed. You know what RSV is, you know how to treat them. The answer is there. Encourage the client to drink water. You think is water dehydration is RSV problem? Notify the healthcare provider. Do you know what would the doctor ask you? Suction the nurse and apply oxygen. Is this appropriate for RSV patient? Document behavior and reassess in 30 minutes. What do you think? What do you think? RSV patient, their nose basically is on fire and they get congested. They may have nasal flaring. It become irritability. Suction them, and give them fluid. Number one is okay, but it's not the best one. You suction first, you give them oxygen, and then you hydrate them because it's not like it's dehydrated. It doesn't want to eat or drink. Therefore, suctioning in the case is much better. So 3 is the best answer. The client with the chest tube with pneumothorax has a constant bubbling in the water seal chamber. What should the nurse do? You have to know what chest tube is. But think about it. I see constant bubbling in the chest tube. If you don't know anything about chest tube, you got to know that this is a closed system. It's a closed system. Therefore, if I see bubbling, something is not right. Something is escaping or something is going inside. That's all. That's the content you need. I say you need some content. You got to know it. Then you got to use your buzzword and some common sense. Something is wrong. That's why there's bubbling in the chamber. Look at it. It's an increased suction level. One says check for hair leak. One said climb the tube. One said document the finding. What would you do? I know you know chest tube. Whatever you know, bring it to this question and say there is a chest tube and there is bubbling in the water seal chamber. Do you expect bubbling in the water seal chamber? That means something is broken in the system. No. Therefore, why would they tell you this and then they want you to document finding? They want you to know if you know what happened in the water seal chamber. This does not happen. It's unexpected finding. So I'm not going to do that. You know you're not supposed to clamp the tube. But if you have to clamp it less than a minute. But most 99.9%, you're not supposed to clamp it. Therefore, I'm not going to pick this, even if it may be right answer. It's partially trappy, right? I know I shouldn't clamp it. They're not giving you a clue that something you can clamp before. The teaching is don't clamp. So I'm not clamping it. I'm bringing suction into the system, right? I know if I bring suction, there will be more bubbling, but would you see it in a water seal chamber? No. This has nothing to do with the suction chamber. They told you it's what? Water seal. If you increase suction, it go into the suction chamber. It has nothing to do with the bubbling in the water seal. Test taking strategy, common sense. I got to pick 3. I know, I don't know what it is, whether it's air leak, I have no clue. But I know 1, 2, 4 are all garbage, and I'm not picking them. So 3 is the right answer. A post-op client has low-grade fever and decreased breath sound in the basis. Don't chase your tail. And this is a question to tell you, don't chase your tail. Don't look for big things. The key word is buzzword is a post-op patient. What do you expect in the post-op patient? Think about it. I've told you, he has low-grade fever and decreased breath sound. That's what a post-op patient does, right? What would you do? Give them acetaminophen, encourage coughing and deep breathing, get a chest x-ray, apply high-flow oxygen. Low-grade fever, decreased breath sound at the basis. Is a post-op patient. What is the number 1 cause of fever and decreased breath sound in the post-op patient? This is an expected finding. It's a post-op patient. The problem is they have atelectasis. These are all little nursing teaching that should just come like that. Patient come to you post-op day 1 or post-op day, they have low-grade fever, and you listen to their long basis. There's decreased breath sound. You know that, oh, atelectasis. Every nurse knows about it. But if they put it in the question form, can you figure it out? This is it. This is the way you present. Post-op patient, low-grade fever. It's not dying. It just have what? Atelectasis. If you have atelectasis, you don't need X-ray. If you have atelectasis, you don't need Tylenol. If you have atelectasis, you don't need oxygen. You need to breathe. Give them incentive spirometer. and let them take a deep breath. A lot of people will pick oxygen. A lot of people will request X-ray. But the first thing is let them breathe. Incentive spirometer. This is the idea of incentive spirometer. This is why we give them incentive spirometer. Number 2. And the last question. I know you this one, you can do it easily, right? It's also a post-op patient, all of a sudden, chest pain and shortness of breath. There should be only one thing that comes to your mind. A post-op patient, chest pain, and shortness of breath. Content and common sense. You've taken care of a patient before. Apply it. The NCLEX is not esoteric test. It's things you do all the time. Chest pain, shortness of breath. In the post-op patient, you know that something is bad. Something is affecting their lung, right? Something is affecting their lung. Look at the answer choice. Do you give them oxygen? Do you call the doctor? Do you check the capillary refill? Or you check about their pain? Something to tell you like pain, yes, chest pain and shortness of breath. There's more than pain. This is not just pain. Even if it's yes, heart attack, I'm not going to ask them about their pain scale. Something, the pain them doesn't mean you just treating pain, right? You know this is pulmonary embolism. Capillary refill is a secretory problem. This is not a secretory problem, right? This is what pulmonary issue. It's not a secretory problem. It's they're asking you that I have chest pain and shortness of breath. Calling the doctor, you got to figure out you can do something before that. Give the patient oxygen. This patient has PE, pulmonary embolism. Capillary refill is just circulation. Asking for the pain, you are ignoring the circumstances. Calling the doctor, you neglecting your job as a nurse. Applying oxygen, you are helping the patient. This is Adapting Class, video number 4, answering questions in the critical thinking and buzzwords and common sense. If you are new, thank you for joining us. You can subscribe to our channel for more content like that, or you can join our membership. You have more videos, over thousands of videos, or you can try my on demand, where I have precise, concise videos for short term, 6 to 8 weeks to master your NCLEX to go take it. Take care of yourself. Thank you for spending time with us. And as always, keep charging. Take care and good luck.